All right, well, welcome everyone. My name is Jess Hegstrom. I am the Suicide Prevention Coordinator at Lewis and Clark Public Health, and we are going to be learning about things that are available in our community, resources, just some general information you should know. So we have a really great lineup of speakers. So I'm going to go ahead and share my screen so you can see that, and then I will talk a little bit about some housekeeping. Can everyone see the agenda? I didn't really do a very good job with this now that I think about it. All right, let's try it again. Here we go. Okay. Yes, so today we are going to be hearing from Tracy Dahl from Intermountain, Ramsey Ballou. Am I totally killing your last name? Okay. From the Holter Museum and Art for Survival, Shelley Oon from Mental Health America, and the upcoming Youth Warm Line. Linda Kinsey will be talking about Helena Indian Alliance's Native Connections Grant. Elena Summers from Girls Thrive. Taylor Dinsdale will discuss tobacco and vaping prevention. I will talk about some of our suicide prevention programs and how you can benefit from those. We will watch a short video on how to support military students. And then we will hear from Laura Cebulski from Charlie Health, Alex Holter, our LGBTQIA advocate, and then Katie Gluckert from AHEC. And then if we have some more time, we might have one more speaker. We do have 10 minutes set aside for discussion and Q&A, and then final words. And so that is what we will be doing. And let me, oh, here's Pam.
Jess, we weren't seeing the agenda slide, but that's fine. I can put it in the chat so people can see. And I've got the waiting room covered.
Thank you. I appreciate that. So we're recording, as you know. We will be running to 2 p.m. today. Here's Taylor. And then please feel free to share your information in the chat, your name, your school, or what organization you might be representing, your job title. We do ask that you stay muted since we are recording. And then the intent of the event really is just to make sure that everyone feels confident going into this new school year with what available resources there are, and just to make sure that you have a little bit of more information going into the new school year. And we also do want to hear from you about any concerns that you have, any things that you're seeing or expecting as we go into yet another COVID year of school. And then you will be receiving an info sheet with resources so that you don't have to memorize everything we discussed. It is not an exhaustive list. We're always happy to add more to it. So if you have something that you don't see on this list, let us know. And then also feel free to just share other resources in the chat as we go along. Okay. Any questions before we get started with Tracy? Tracy, do you have a slideshow to share?
Sure, I can. I wasn't sure if we would be, but I have.
Totally your call. Just a question of whether or not to make you a co-host.
Yeah, I can share a slide or two.
Okay, let me do the thing. All right, there you go.
I can. Okay, are you guys seeing my screen? I hope.
Yep, looks great.
Okay, so I'm Tracy Dahl. Thanks for having me. This is really exciting, and I was happy to connect with everyone. I am the Therapeutic Education Services Manager at Intermountain, currently also serving as the Interim Clinical Director. But I've been in therapeutic education here for about 6 years. I'm really excited to let you guys know that we are holding on to our CSCT programs. So we still have CSCT in the Helena School District and the East Helena School District. We're in a bit of a rebuilding period, sort of due both to COVID and also just the CSCT rule changes that we experienced last year. So we don't have quite as robust of a CSCT program as we have had in the past, but I'm confident we're going to get there again. We also have our school-based outpatient therapists in the Helena School District. So those are outpatient therapists that just have an office in the schools. And we have those at Helena High School, Capitol High School, C.R. Anderson, and Helena Middle School. So that's another school-based service that we provide. We also have our outpatient clinic that has outpatient therapists, play therapy, occupational therapy, case management. Hi, Kim. And we have expanded recently our psychiatry services that we offer in our outpatient clinic as well, which includes 2 APRN med providers. And one of those med providers does do all telehealth. So if there's folks who are in rural area or remote area or live in, surrounding areas like Boulder, Townsend, places like that, our telehealth provider is taking referrals currently for med management and med evaluations. Let's see, what else am I missing? Trying to talk fast. Our residential facility, I think I always forget that because it's just kind of our constant, but our residential facility is still going strong. We had some ups and downs with COVID again with that, where we decreased numbers, but we currently have 3 cottages going and working on the 4th. So residential is open for business as well. Kim, am I missing anything?
No, I don't think so. I can't think of anything.
Okay, yeah, I think that's it for us for Intermountain. We're excited to get back to the school year, and we did run I do want to say we did run our CSCT program all summer, just like we always do. So we've been with kids that are in programming all summer long as normal. And we'll be with them as soon as the doors open to the schools. So excited to be back in school and with the kids in that setting too. So does anyone have any questions for me? Or you said we're doing that at the end. Never mind. Thank you for having me. Appreciate it.
If you do have questions, feel free to throw them in the chat and Tracy can answer those, or we can wait till that end and go ahead and answer the questions. Thank you, Tracy. So next up we have Ramsey. If you would go ahead and introduce yourself. Do you want to share any slides? Because I can make you a co-host.
I do have a video that I'd like to share.
Sure.
My name is Ramsey Ballou. I'm the exhibition and collection manager at the Holter Museum of Art in Helena. I'm standing in for Anna Lund, who's our education programmer. She's on vacation and working from Minnesota right now, I think. So she asked me to pop in. She's working with those kiddos at the moment, but I wanted to talk about our Art for Survival program, which is a teen program that the education department leads in response to, in 2017, our community saw kind of an uptick in suicides, in teen suicides. And so our education team developed kind of a safe space for after school programming that's free to students who want to be a part of it. And it's really, it's a writing and art workshop that's led by our education team, but is really more of a community for the students to just low pressure be themselves and kind of have a consistent and safe place related to art and self-expression. And so I will share a video that they put together. And again, I don't lead this program, so I am secondhand information on it, but it is a really strong program and I've seen the students really thrive in that environment. And I myself came up through the education programming at the Holter, and I can attest to sort of the networking that they build between teens who are often isolated and feel a bit alone. So I'll show this video 1 second. All right. Are you guys able to see the video?
We can
So we
see
can
it, but
see it.
not sure if sound is coming through.
Okay.
You can stop sharing and then reshare with the sound. You also sent me the link so I can share that if you'd like.
Okay, just 1 second here. Let me figure this out. Oh, I'm so sorry. Oh, here we go. Let's try again. Sorry, guys.
No worries. Zoom is all the different platforms to make it so confusing.
Yeah. Let me try this 1 second here. Better. I was hooked up to a second monitor. So let's try that.
We're here, and we all know we're here, and we all know we're surviving. I thought it'd be like more of a class.
So the sound is not great. Would you mind if I tried to share it?
That would be fine. So sorry.
Okay. Nope, no worries.
It's the 6-minute one. So we'll do a
Great.
12-minute one too, but I want to keep to our
Julie, you might want to share the captions too.
Okay, good idea.
Thank you.
What am I doing? I am sharing this, share sound, share.
We're here, and we all know we're here, and we all know we're surviving. I thought it'd be like more of a class than actually being the most like free place ever.
I never thought I'd hang out with teenagers. Teenagers scared me.
My case manager at school said, hey, I have this friend, she runs this really cool art group, and I said, I'm not going. And she said, you know, I emailed your mom wants you to go. I said, I'm not going. To make sure I didn't get grounded, I went. I kind of realized that it wasn't a therapy group, it was a place for people to feel safe.
Because of the challenges our community has had with teen suicide in our schools, I think there's been 7 in the last 5 years, that's incredibly scary. There's something going on. There's something that we need to do. I started thinking about how the museum might provide programs or space around helping kids find their voice.
I think when we say like survival, maybe seems a little bit dramatic. It is an art for survival class. It has helped me with a lot of things, and especially it's been a huge coping mechanism.
What we're doing is creating a space for teens, access to art supplies. It's not a clinical environment, it is a creative environment.
I look at it as art to save the person who was contemplating suicide. Art to save the person who was going to drag themselves through life and was essentially going to die inside. The artist who was told that art will take them nowhere, they survive.
Helena is definitely has dealt with a lot of suicides. When I hear something that happens or someone talks to me about it, it'll bring up my own past of dealing with it with family and myself personally. It's 5th grade. That's actually when I tried acting on it. The one thing that always got me was after I came out of the hospital, my counselor's like, it's gonna be okay. I wish someone told me that. It's gonna be okay. You can't just end it all. You have so much waiting for you. It will get better.
I didn't think there was anyone to talk to because, I was scared about what they would think, or they would be like, oh, buck up.
There's a dialogue between everyone, and we are able to talk about the things that are weighing on our minds, and I think here you can just be what you are.
The minute we walk through those doors, we know we're accepted and we know we're in a safe place.
There's theories in psychology and education of flow. getting to a space in your life experience where you're so involved in something that time and hunger and things like that kind of fall away because you're enjoying what you're working on. And that can happen when you're playing with art materials or listening to music or writing a story or experiencing art. I mean, it's not, well, I almost said it's not something that's going to heal the world, but I kind of feel like it could.
Yeah, it lets you take the things that you feel and let them go.
The art is everything in Art for Survival. It's the people, it's the places, it's the things we see, the things we do. That is the art in Art for Survival. Every single time I come here, my mood is 100% improved. I feel a lot smarter, I feel a lot more creative. It can be really difficult to find yourself a safe place where you can express yourself in ways that you never imagined. But Art for Survival is just kind of like, our arms are open. Make something, create something, be yourself, express yourself.
I don't know, I'm really glad we have it here, Holter Art Museum. I never thought I'd ever be part of it. If you're an artsy-fartsy kind of kid, you need to come over here because this is gonna like open your life up to so many things. I mean, it's what's kept me going.
Teens need it. They need a space where they can be themselves and they can just come and sit with what they're feeling and put it into these great pieces of art or great pieces of writing.
I want them to leave with confidence. They no longer feel alone. Perhaps they've learned that who they are is beautiful and they're valuable human beings. Connecting with art can make your life better.
The biggest thing that Art for Survival has taught me so far is that I have the tools. I will make the tools if I need to build up myself, build up others through art, through music, through writing, through friendship. It's everything I've needed. It has definitely changed my life.
Well,
Is
thank
it okay
you.
if I stop it there?
Yep, no, that's great. So that's kind of a synopsis of the Art for Survival program. We have a sister program called Art Feeds, which is geared towards middle school students. And so we've separated the age levels just so that kids have more of a relatable experience with each other, because what you go through during those different age groups is so different, and your development is so different at those times too. So they found that that works best. And so it is free to students. It is sponsored and funded. And so Art for Survival meets on Tuesdays from 3:30 to 5:30, and it's currently meeting and it's geared towards ages 14 to 18. And then Art Feeds, which is the middle school age group program, is Mondays from 3:30 to 5:30, and that's geared towards students 11 to 14. And that one will start up September 19th. And so I put that all in the chat, but it should be on the resource sheet as well. So are there any immediate questions? Or I can wait till the end.
How do folks sign up?
They go online to theholtermuseum.org/education. And I put the direct links to the registration pages in the chat. And that'll also give you, so it's a registration page, but it'll also give you some more information about each individual program as well.
And are there openings or do you cap?
I believe they cap each one at 15, but I also think that the Holter is pretty committed to serving the needs of the community. And so I know in the past when it has reached like 28 to 30 students, they've opened up a second chapter or they bring in more facilitators as well.
Is there a rolling enrollment or is there kind of like cohorts that start?
Nope, you can join at any time. Mhm.
Awesome, thanks.
Yep, and a lot of times through school breaks and things, the education team really values that consistent connection with students. So oftentimes they will keep the Art for Survival program going. They've kept it going all through the summer so that the students still have that link, because they do tend to bond and rely on each other a lot. And so they do try to keep it really consistent, even with the breaks in the school schedule and vacations and things.
And Linda had a question in the chat. Is there a wait list for the Art Feeds class?
Not that I know of, but that would be a really good question for Anna Lund, and her email is also in the chat.
Okay. Yep.
Thank you guys so much for your time. I really appreciate being here.
We appreciate you presenting. So, and I really love Art for Survival. I refer kids to that all the time because it's important that they get mental health care if they need it, but it's also important that we increase connection and give them outlets to deal with these issues in a healthy manner.
Absolutely. And we are not trained counselors or mental health providers in any way. We are simply educators and artists ourselves. So it really is just geared towards peer-to-peer connection and a safe environment for expression. And so I've passed on all of your resource sheets as well to Anna so that she has some of those more clinical resources available to her students as well and parents.
And we have one more question, then we'll move on to the next presenter. Are the classes structured 2 hours or able to come and go as desired?
I'm not sure about that. I would assume that they would be able to leave if they feel the need to, but that would be a great question for Anna. I'm sorry.
And then one question I do have is like, if you had a kiddo from Jefferson County, would this be something they could participate in if they had a ride?
Absolutely. Yes,
Okay.
absolutely. It's not really connected with the school system in general. It is really for teens.
Awesome. Thank you very much, Ramsey.
Thank you so much.
All right, next up is Shelley. Is Shelley with us?
I don't see her.
Okay, well then that being the case, Linda, are you ready to take over?
Sure.
And we can, if you want, we can share a screen of those documents you sent, or you can, it's whatever is easiest for you.
Yeah, if you could, that would be awesome.
Absolutely. Julie, you're sharing those,
Yep.
right? Okay.
Yep, I got it. Here's first.
Well, I'm Linda Kinsey from the Helena Indian Alliance, and we have a Native Connections grant. This is kind of a picture of who we are. It's from the Substance Abuse Mental Health Services Administration, SAMHSA. And maybe just the next screen on how many grants there are here. This is a suicide prevention grant for Native youth ages 12 to 24. We have the theme of culture as prevention. So we try to provide the community. Could you just scroll down? It's the map. Yeah, right there, just to show you how many. This is from 2019. So we do have an additional, I think there's almost 300 of these grants spread across the United States for the implementation of culture as prevention theme among Native youth. Of course, we know that Montana is among the highest in suicide, deaths by suicide, usually rates in the top 5, if not the top 3 in the United States. And certainly Native youth are the highest in that category of youth-related deaths by suicide. And so that's pretty much the theme of our grant. The next, we could close that one, and the next one is sort of about our goals and going into year 3. We are in year 3 of our grant, which started July 31st. So immediately, within the next couple months or so, we do want to provide, and we are planning to provide parenting classes here at Helena Indian Alliance. So the parenting class is a 10-week or 8-week, curriculum designed by Indian Child Welfare. So we can take referrals from CFS, from our clinic here, and from individual parents if they would like to take this class. It's really awesome. It presents on child rearing practices, traditional child rearing practices, some on historic healing from trauma. And so that's what we're going to be doing from September to November. So another one of our goals is to increase student access in the Helena Public Schools through robust outreach, possibly a MOU, and we'd really love to have a youth group either at the school or at our site here. We're in the process of looking for if we want to do our own or just look for one that is already available to provide community education on the risks of suicide and resources. And then we do want to continue to provide culturally relevant activities in the Helena community. So somewhat more midterm or a little bit longer away, our goals from like September to February are to create a referral pathway to prevention education and resources, continue outreach to Native youth and families. By that referral pathway, it really is involving the continuum of care, using prevention at intake or at the onset of the patient visit, and follow them all the way through discharge or even beyond that. Because I think that's the true continuum of care, or an accurate picture of the continuum of care as far as prevention, not only with cultural programs like ours, but all preventative programs. We do want to also provide weekly on-site activities for Native youth ages 12 to 24, continue community collaboration and networking. And we are working on integrated health plans to include what I talked about previously of using having continuum throughout the whole continuum of care. And so really grateful to be part of the Lewis and Clark Suicide Coalition. It's created some open doorways and some opportunities for collaboration for our program. And so Jess, you're really, I have to congratulate or applaud Jess for her enthusiasm and her robust activities in the community. And so I really don't have anything more. I just wanted to do a short run through of our grant, and hopefully we can, get some ideas or some input about more collaborative involvement within the public school system. We did last year, I was looking for numbers, data of how many students that are of Native descent within the public school system here in Helena. And so the data from the 2019 school year indicated that there were 1,200 plus registered students in the Helena area in the public schools. That doesn't count the alternative school or the colleges, but certainly a decent amount of students that we can hopefully provide services for. And of course, all of our services, including health, education, and prevention, and community activities here at Helena Indian Alliance, are open to all people. So thank you for having me. Have a good day, and certainly could answer some questions if you have any. Thank you.
Thank you, Linda. Thank you for joining us. If you could give a takeaway for the school counselors that are represented here, should they call you for training? Should they partner for events? What do you think would be a great way to move forward?
That's a good question. Whatever doorway we could collaborate with. I personally am a retired school counselor, and so I'm aware of some of the busyness that school counselors do have. I was a school counselor K through 12 in a Class C school, 380 students, and I was the only counselor. So, but I was also engaged in creating the calendars for collaboration and for visits and for training. So I don't know if the school counselors nowadays do that. And so anything, we do have training, we have CAN trainings, ACEs, trauma-informed care through a traditional Native Plains lens, just different resources that we have through our own staff here, and also through SAMHSA with their resources. So
if they were interested in learning more about that trauma-informed training, would they just give you a call, Linda?
Sure, yeah. I'm doing a few public trainings here in Helena through AWARE. And gosh, I can't remember. I'd have to look through my calendar. And we are going to do a live Zoom, or I don't know what it's called, but training on our social media platforms. I believe in we were trying to get it through for Suicide Prevention Month in September, and hopefully it'll be ready by then. And then the other thing, yeah, if anybody has suggestions, I haven't created a community, prevention document yet, but because there's probably already some available, but we wanted to have it specific to our community with resources, because when we did the community resource assessment, that was one thing that that led us to a need that the community really does need some visual, like on the signs and risks of suicide, and also resources. So just maybe some people don't engage in social media or computer, things like that. And so we were going to post on our websites as well, but in other places around the community. So if anybody has any information where I could look, I haven't really developed those yet, but I hope to by the end of September and get those posted everywhere. There's Shelley.
Thank you, Linda. Julie, should we have Shelley come back in at this point, or what would be best?
Yeah, I think that's fine. I think we're good on time.
Okay.
Can I ask Linda a quick question? Are the parenting classes focusing on certain ages of the kiddos?
Oh, just foster parents, parents, just teen parents. It's a very inclusive curriculum. It's evidence-based, and it's been in use and updated about every 10 years for about 50 years now. And so it's a really good curriculum. And then sometimes what develops from there is a parenting support group, because this isn't a support group, it's parent education. And so anybody and everybody that are parents are welcome.
I'd love to invite you, and I'll send you the info for the home visiting task force. So that's public health aware, Florence Crittenton. I'm missing some folks, CPS.
Yeah, good idea. Yeah.
I'll send you that. Thank you.
Awesome. Thank you.
Alrighty. Thank you, Linda. Shelley, do you have any slides that you would like to share, or would you just like to? Okay, I'm asking just to make sure that you have the ability to share if you need to.
Yeah, no, I don't. Thank you.
All right, the floor is yours.
Oh, great. Hi, everybody. My name is Shelley Ani. I'm the Executive Director for Mental Health America of Montana. And nice to see some new faces and faces that we already know. Linda is actually part of our warm line. She used to be part of our COVID line. She's an awesome resource for everybody. So right now, what we are doing, or what we have been doing prior to the pandemic, we had been working with a group of youth to develop and implement a youth line. And at that time, we got kind of a website and stuff, and we were ready to turn on the line, and the COVID hit, and all our kids kind of scattered. So since last year, we picked back up. We have another group of youth that we're working with. We have a website, we have an Instagram, we have a Facebook page, and we have quite a few youth that are ready to roll out a youth line. Not really sure that I'm calling it a warm line, but what we wanted to do was we wanted to give the opportunity to some youth to know what the nonprofit world is like, to start a board. And so that's what we've done. We've helped them start a board, pick their mission, put together a website, and then they have some fantastic ideas of what and how their program looks, which is starting a youth camp where everybody can join. And it's not going to be attached to a church setting. They like to offer some great classes like yoga, self-care, maybe relationship building, helping with building up resumes, and how to form a board, like a youth board. But they have some other great ideas, which I think are really awesome. So right now, that's where we are, is they've done all that. They put some things together. And now we are just kind of searching for more youth, and when that great opportunity is for us to turn on a youth line, and it's giving them a job to help their peers overcome some great struggles that we and them go through on a daily basis, which we know happens here in Montana. We really don't have enough resources for youth. And even at that, we have very limited resources for youth in general, especially when it comes to mental health. So that's kind of a really short spiel of what we are and what we do. I can tell you that we've been managing the Montana Warm Line for 14 years. And we got notification a couple weeks ago that the state is terminating our contract. Since they turned on the 988, I guess they felt that we didn't need any more resources here to help our community. So they terminated our contract, and that will go until the end of September. So in the meantime, I'm running around finding more funding so that we can keep going, because it is well needed. It's very valuable.
What's the difference, Shelley, between
so-
988
yeah.
and the warm line?
So the 988 is a crisis suicide line. It's for those that are in dire need. They have a plan. They are hurting themselves. They might be in danger to others, and they need help ASAP. We are the Warm Line. We are recovery base. So we get the calls that people are struggling, but not in a dire need of a crisis at that moment. I can tell you we took over 8,500 callers last year, and I honestly don't know where to even send them. The feedback that we get is that we're not allowed that those callers that we get, they're not allowed to call the crisis line. They're not in a crisis. They're not, they aren't worth anybody to talk to, and they get sent over to us. We do know that the suicide line sends some of their callers over to us, so I'm not sure how they're going to handle those callers now.
So with the youth line, would it be serving a similar function, or what would it be used for?
It would be youth reaching out for youth, because that's who we know is going to reach out to is another youth. And what will be is there'll be they really start at 18 that will be managing the line, so that they get the proper training. And if they are in a dire emergency, then we would have those in practice of what needs to happen and how they need to be addressed, and where they can actually get immediate services. So we will definitely be in touch with whoever needs to be in touch with. I can tell you that we haven't had the best success of partnering with the suicide lines. So we will just have to kind of figure it out, because that's what we do. Let's figure it out.
We appreciate your tenacity for sure. Do you have like a guesstimate as to a timeline?
Well, we were hoping by the end of this year that our line would be up and going. So that's kind of what we're shooting for. We're still, we did get some funding, and I like to ensure some extra funding so that we have the ability to pay our workers and to keep it manageable. So that's what we're doing.
Thank you, Shelley. I really imagine this as being something quite helpful for youth. We had a meeting with Josh McKay, and he was talking about how he wished there was like a hotline that youth could just use. And so I imagine this really meeting that need. So we're looking forward to learning more and seeing what you got and potentially helping that out with marketing.
Yeah, I've been working on this for a long time. Way before we even had kids on board, because I know what it's like growing up and not having any kind of resources or anybody to talk to. And we do go on the ground and talk to other youth, to schools and teachers and stuff. And we do present them with this, this is a service that is managed and for youth, with youth, and that, getting that feedback from everybody, it has been really helpful. And so I think for us, it's moving forward and keep going and hoping to get that hotline back on for them.
A quick question, Julie, do we have enough time to have Shelley tell us about this youth conference that's coming up?
Sure.
Do you want to share about the youth conference?
Yes, I can. So we have our youth conference, Youth Empowerment, September 9th, and it's all about the voices of the youth coming forward to talking about their challenges, talking about what they like to see in the state, what they like to see as resources, and what is really the near future for resources and what they could, what we could build on. And we have some great speakers, Dr. Zuby, we have somebody from Charlie's Health, we have Jess is going to be talking, and we have a few other, we have SAMHSA coming down to play a part of that, as well as the Children's Bureau chief, Megan Peel, a few others, and our youth that will be speaking as well. We're kind of in a predicament right now, because as of today, we don't have a whole lot of people that have signed up. I really like to get to at least 50 people to attend, and right now we're at 15. So I really have to make that decision of, do we go forward or do we reschedule? And I don't want to waste anybody's time. I know that everybody is going to have a powerful statement, because we did invite some senators, some representatives, but we're really kind of in that time crunch of, at the end of the week, where do we lie? Where do we stand? And what do we do? So
one thing that I would suggest is if you are willing to drop the link to register in the chat, if anyone's interested, they could join. Is there a fee?
There is a fee. It's very minimal. It's $50. And we also, there's our website link, and that right off our website, you can register. We did get the approval to do the CPEs and the OPI credits. So we're asking everybody that needs those to let us know, so that we turn those names over to our state contact, and they will send out the form, and they will get you those credits, which are 6.5 credits, which I thought was really great and handy.
Yeah. Thank you, Shelley.
Yeah.
Any questions before we move on to the next speaker? Okay. Thank you so much for presenting. We appreciate it. And please feel welcome to stick around. We're going to have questions at the end. All right, awesome. So the next person up is Elena Summers.
Yep, right here.
All righty.
Hi.
Do you need a sharing function?
No, I don't.
Okay.
Yeah. Thank you, though.
Thank you.
So Girls Thrive is a program for all self-identifying girls in the grades 6 through 12. And our mission is essentially to inspire girls to empower themselves through a variety of physical activities and educational lessons that help to promote self-confidence, self-esteem, and a positive body image. So as I often look through a lot of statistics to help us put together our curriculum to find out where there are deficiencies and needs for these girls, one of the ones that I came upon recently was the most recent 2021 Montana High School Youth Risk Behavior Survey. And two of those that I like to really focus on are the one on physical activity, where it says only 17.9% of high school girls reported that they were physically active on each of the past 7 days, whereas nearly twice as many boys, 33.7%, were physically active on each of the past 7 days. And then the second one that I like to focus on is regarding mental health, where 41% of high school girls reported that their mental health was most of the time or always not good during the past 30 days, compared to only 21.8% of the boys. So at Girls Thrive, we know that mental health and physical activity can go hand in hand. And that's why we really try to focus on those two together. So during the program, how do we try to build this or inspire the girls to empower themselves? And I often tell them, we can't give you self-confidence, but we can give you the experiences and the tools so that you can become empowered yourself. And so during the fall and the spring, we schedule an 8-week session where we usually meet 2 to 3 times a week. This fall, we're meeting 3 times per week. On Monday, we go to Stone Tree Climbing Center. On Tuesday, we meet where we have our office, which is at the First Christian Church. We rent some space in there. And we meet there, we go running, and then we have an educational lesson. And then on Thursdays, we meet for some mountain biking. These are Monday, let me back up. Monday, that goes from 3 o'clock to 4:30. We're trying to take advantage of that good time where the kiddos get out early from school. But we also realize that not all of them get out that early. And so some of the girls and families wish that we could do it later, but we're taking advantage of the time that Stone Tree is giving us, and they don't have time later. So, and then Tuesdays and Thursdays, we meet from 4 to 6. To give you an idea, that's fall and spring. That's usually our schedule. During the winter, we meet for 6 weeks, and that's usually Tuesdays and Thursdays. And due to the weather, of course, then we choose different activities. We have a lot of swimming, yoga, Tai Chi. We do cross country, skiing. We offer the girls a variety of physical activities because those we also feel go hand in hand with trying to get the girls that confidence to try something new and fail within a safe environment, or try something new and fall in love with it and really want to pursue that lifelong lifestyle of being physically active. Because again, we really see those as the potential to go hand in hand, mental and physical activity. So we try and help the girls find something that they can fall in love with to promote that mental well-being for a lifetime. So just to give you an example, what we do, our schedule for this upcoming fall that starts on September 6th, the first week, we will have a lesson on affirmations and mantras together with an art project, a metal stamping art project. The next week, we will have a lesson on how to embrace a running journey or how to start their own running journey. Following that, then we have friends, cliques, and mean girls and how to handle it. The week after, or I'm not going to go through all of them, but we also have, let's see, one on stress management. We have one on inner strength. The one actually from stress management, it's a psychiatrist and she's coming to teach that lesson, Dr. Bridget Crowley. So these are just to give you an idea of the topics that we cover, but together with those, like I said, we cover physical activity together with trying to give them a place where they can not only feel safe, but try to open themselves to that vulnerability and provide a brave space where they don't have to be perfect. They don't have to meet a criteria of a sports performance, if you will. So that's how we try to reach it. Now, the registration is open right now. We do cap it at 20 girls for the time being, and we are halfway full right now. We offer scholarships to every girl who needs it. We don't want that to ever become a challenge for them to belong. But yeah, we do cap it at 20 girls per session. There is a cost of $130, but again, there are several families that can meet that and others that can't, and we never turn down a girl. I'm also interested in coming to each of the schools, perhaps later this fall, to meet with the girls, maybe have pizza and some fruit or something over lunch, and just share with them some of the things that we do and how they might enjoy it and want to be a part of it. We did that to a couple of the high schools, and so I'm hoping to get into more of the middle schools, and I would even welcome going into 5th grade schools towards this spring, so that they can know that they can participate in our, like even our summer confidence clinic, which happens over 2 days. And we just try and help give the girls a little boost of confidence, or tools to give them confidence before school starts back up. We just did that last week. So I will drop the link for registration in the chat. I think that's all that I have right now. Do you have any questions right now, or shall we just wait for the end?
Elena, there is one question that says, can you restate the ages for the girls to participate?
You bet. We don't go specifically by ages. We do go by grades. So it is 6th grade to 12th grade. So we have girls as early as young as 10 and 11, upwards to 17 and 18.
Lovely, thank you.
Yep.
All right. I love that you have scholarships so that no child is turned away. That's amazing.
Yeah. We don't want to turn away any of the girls when all of our coaches are super passionate about this. They're all volunteers, and I myself, I'm a mom of 5 girls. I kind of get a glimpse into what, they're going through. And so, yeah, we want really to be able to reach more girls that we can offer these scholarships to, because right now we have a lot of families that come back and do this several times. And we would really like to reach out, because it's an opportunity to be able to do something without a team or a club, where you don't have to have a certain performance in order to belong and participate. So we love it.
Awesome. Thank you so much.
You
All
bet.
right. Next up, we have our very own Taylor Dinsdale, who will be speaking about tobacco and vaping prevention. Taylor, do you want to be able to share screen?
Nope, I don't have any
Okay.
to share. It's just me talking for a little bit.
Thank you.
Yeah. So as Jess said, I'm the tobacco education specialist. So a lot of prevention efforts in the schools. There's also a youth quit line we help promote. It's called My Life, My Quit. So that is basically a confidential quit line for youth to call, text, chat on the internet with somebody to help quit vaping, smoking, chewing, whatever that they may need help with. Statistically, it's most likely vaping, but the quit lines for to help with any tobacco products. So that's a really cool resource for students to have access to. And then I just wanted to go over a few quick things that prevention activities. We get a REACT grant every year. So we have a little money to conduct a few activities. Last year, those included, we did a React dodgeball tournament in Broadwater County, which we had an amazing turnout. I'd love to do more of those in the Helena, Lewis and Clark area. But we just had vape prevention messaging throughout the whole week at school. And then Friday, we ended up with a dodgeball tournament that was a community-wide event. So there was almost up to 300 people, I think, participating, which is really huge for Townsend. That was a really fun thing. We got to do a community event with that grant. And then we also do an annual art contest. You might have seen some of it. It's social media based, so a lot of the ads are targeted at youth, created by youth, but those are on Snapchat, Instagram, Facebook, trying to reach kids where they're at. And we had a lot of amazing submissions this year. We had a record-breaking year this year with 186 entries. So that was amazing. We'll be doing that again this year, hopefully keep that going. And then another thing we focus on are like days of action. So this year we had an awesome turnout for Take Down Tobacco Day. We had a few schools participate in park cleanups. We keep all the cigarettes and tobacco products separate so the students can kind of see and learn how much of an impact it has on our environment, because those are one of the most littered objects worldwide. So we were really successful with that. Something we'd like to get more into this year is Red Ribbon Week as well. But yeah, that's a very fast and furious overview of what we can do with youth, what we can do with the schools, how we can help with cessation efforts. Another really cool thing we did this year was help the counselor at PAL get trained in a cessation program that they can actually conduct at the school. So the students don't have to travel anywhere. They don't have to stay after school. It's literally can be part of their school day if they'd like. So getting students that help they need to quit vaping because nicotine is highly addictive and it's all too accessible, unfortunately, for some of these kids. So yeah, that's all I think I had. If there's any questions.
Taylor, how big of a problem is tobacco and vaping in our school systems?
So Montana is pretty close to the national average. About 26% of kids regularly vape, and then over 50% have tried it. So there's over a quarter of them that vape regularly, according to the last survey, the last YRBS. So that means 74% don't, which is great that a majority of them aren't vaping, but 26% is still quite high. So it is a problem. And just hearing some of the stories from principals, they find them everywhere. Heard one principal found like 50 in a car. So from one of the students. So unfortunately, yeah, it is an issue. Thanks, Jess. Were there any other questions?
So then could school counselors request some of these things from you directly?
Absolutely. Yeah. And school counselors are a great way to plan these activities too, to get in with their students. I'm also always happy to come present to classes, health classes, whatever. So.
Would you be willing to pop your contact info into the chat?
Yes, I will.
Does anyone have any questions before we move on? And there will again be time at the end for questions. Okay. Well, next up is me, actually. So let's do that. Let me pull up my PowerPoint. Julie, is that visible?
Yep, you're good.
Awesome. We did it. Okay. All right. So let me oops, get rolling. So I just want to make sure that our educators or school counselors are aware that we are offering free education, and you can request these things. We also offer them regularly in the community. So if you would like to have a few extra tools in your tool belt, we're here to support you on that. We offer training that you're all probably pretty familiar with some of these models. QPR is only good for 1 year. So we suggest that you get it really every other year just to keep your recognizing skills sharp, because, you know, the more time that passes since the last time you received education, the less likely you are going to be to recognize something. So it's just good to have that regular education and to continue to hone your skills. We also have a training called Youth Mental Health First Aid. So this is a bit longer than QPR. QPR can be delivered in an hour and a half to 2 hours. Youth Mental Health First Aid is 6.5, but again, that's something we're willing to offer. We can split it into halves. We can hold them in the evenings, whatever it is that helps you. But Youth Mental Health First Aid really is an early intervention program. So it's about recognizing warning signs early of a mental health challenge and trying to catch youth as close as possible to onset of a mental health condition so that they can develop skills and tools to learn how to manage these things throughout their lives. So it goes over prevalent mental health challenges, anxiety, depression, bipolar, schizophrenia, and then gives you a framework on how to approach youth. So it uses something called ALGE, which stands for Assess for Suicide Risk or Harm, Listen Non-Judgmentally, Give Reassurance Information, Encourage appropriate professional help, and encourage self-help and other support strategies. And thinking back on the presenters we've had, you know, we are looking at both sides of that puzzle. It's important that they have therapy and support groups and all of that, but it's also really important that kids have access to outlets, that they have abilities, the ability to be an art for survival or something else that helps them manage some of their feelings and some of these harder situations. We also have Assist, which is a 15-hour training that we do in partnership with Fort Harrison that's offered quarterly. We can also offer you counseling on access to lethal means. Unfortunately, lethal means are a really important part of the conversation around suicide. So we know that most suicide attempts involve pharmaceuticals, and most completed suicides involve firearms. 63% of all firearm deaths and suicide deaths in Montana are by suicide. And so it's really important that we create time and space between someone who is thinking about suicide and the device they might use to take their lives. And so we hand out gun locks. We offer this education. There's an online version. We also have a program called Suicide Safe Care Tools that also goes into lethal means, but it can really help school counselors understand how to do screening, risk assessment, safety planning, lethal means counseling, and follow-up care. We know in hospital settings, when all of those things are applied, it can reduce suicide risk by up to 45%. And these are things that can be applied in the school setting, you know, and we want to help you to navigate these conversations, because we know when we're talking about firearms, we have to be really cautious to make sure that people don't think we're gun grabbing. But we also know if people don't have immediate access, they're just more likely to stay with us. And we know the time between the decision to make an attempt and the actual attempt is usually 5 minutes to an hour. So again, we just want to slow things down, and we have education to help you, to help the families you work with. So we're here to help. Also ACEs education, just like Linda was talking about, something that is readily available in the community. And then we are also offering a new training on military cultural competency. We have a lot of military youth that we're working with in our schools, because Montana has a lot of military. So all of the training that we offer does cover requirements for behavioral health professionals to keep their licensing under the Department of Labor and Industry. So if that is a need, we are here to support you. And again, this education is free. So going into our Military Strong campaign, so this is a challenge program that we've been doing for the last 3 years, and we are now offering training specifically for schools, because we know that when a parent serves in the military, so does the kiddo. And so we want to make sure that they're able to get the additional support they need. So for example, if a parent is deployed and we see their grades dropping, that we know to address that and start having conversations with them. So the courses that we're offering, they're 3 It's all of 45 minutes long. It can be watched pretty quickly, obviously in 45 minutes. And we're going to be showing you a video of this momentarily. I just have to pull it up. And then it's really about making sure that you're aware of family and student needs. Kids tend to be resilient during a parent's first deployment, but that resilience tends to decrease with subsequent deployments. So we just want to make sure that you are aware of what to expect. So if you do take the training organizationally, so for example, if Helena High School decided to take it, 50% of staff took the training, then the school would be considered military strong. And then there's a bunch of awards that go with that. But ultimately, if you just want to take the training, we're happy to help you get there. And again, it's free, it's 45 minutes, and each one is about 11 to 15 minutes long. Going back to addressing lethal means, again, we are happy to provide this education. We also have gun locks and drug deactivation systems to give out. So if you want a stock for your school, tell us, we're happy to provide, and we have materials to go with it. And then we are also interested in creating some more youth-focused materials. So if anyone is interested in participating in our leadership team for our Safer Communities Montana project, please let me know, and I will drop my email in the chat at the end of this. And then last, postvention. I'm sure you're all familiar with this at this point, but the Montana CAST-S toolkit is available to you. It is on the DPHHS website. Also, a lot of you received books. If you haven't, you need one. I have some. So does the Office of Public Instruction. We're happy to get you hooked up. Another thing that we are working on, Julie and I have been pretty busy on this one, is postvention mapping for our school districts. We're starting off with Helena schools, but basically who responds when there is a suicide and how do we coordinate those different efforts to make sure that we're meeting the needs of students at the beginning of a loss and beyond. We want to have a form of, continued care so that they have multiple opportunities to explore these feelings. And we know that when we've lost someone to suicide, if it's someone we're close to, we're at a 3 times increased risk. So we want to make sure that we provide as much support as possible, and that support's not just coming from the schools, that it's also coming from community resources. And we want to make sure that there's a smooth process, not a bunch of just everyone rushing the scene and it getting out of hand. We want to make sure that it's coordinated. So if you're interested in that, let me know. But Josh McKay has been part of this process, as has Dan Rispens from East Helena Schools. So that is something we will be continuing to work on. And that is pretty much what I have. The other thing to know about is we have a lot of ways to access resources and to make referrals. So 211 is one that it has updated information about available resources in each community. You can go to the website, montana211.org, or actually call the number. It's also connected to the new suicide prevention lifeline number, 988. So 988 can actually make referrals over the phone. There's also the Connect referral system, which Julie can touch on really quickly if you'd like to, Julie. And then there's the Bright app, which is not an app. It is actually a website, but it is a way that regular folks can find therapists that are available in Montana so that they can be more involved in finding someone that's the right fit. And it's a little bit more user-friendly than the Psychology Today. Julie, anything else you'd like to say, that this is more your wheelhouse than mine?
I'll just jump in and add. So Connect is the provider-to-provider facing referral system, which would allow you as providers to send referrals on behalf of your clients and make sure be able to see that the clients got the referrals they needed. And the client is getting a call from that agency you're referring to, which takes a lot of the burden off of a busy families and kiddos and all of that. So all of the links to these are in the resource guide, and I'll drop that in the chat as well.
Thank you, Julie. All right, so next, let me go back really fast. Next is the Military Strong video. I have to get it queued up, so I was wondering is it Maren who's representing Charlie Health, if she'd be willing to go now?
Sure thing. I'd be happy to.
Thank you very much. Do you need the ability to share screen?
Yes, that would be fantastic.
Let me get you set up.
Thanks.
There you go.
Okie dokie. Here we go. Well, hello everyone. Happy Tuesday. Hope everyone's summer is treating them well. So my name is Marin and I am the clinical outreach manager for Charlie Health. They work really closely with Laura Sobolski. She's our director here in Montana. And I am here just to share a little bit more about our program and what we do for teens and young adults in the state and students who are going through a mental health crisis. And what we do, our program is just one small piece of the, massive behavioral healthcare continuum of care puzzle in our state. But we hope that, our piece of the puzzle is big enough and impactful enough to be useful to all of you. So Charlie Health, we were founded back in January of 2020. Right before the pandemic, as a way to provide high acuity and accessible mental health care to teens and young adults in rural Montana. So from the very beginning, we decided to be a fully virtual program to provide people, in anywhere across Montana, the same, level of care and quality of care that, someone would get in LA, for example, or these like resource rich places. So Charlie Health was really born as a way to provide that type of care for people who need more support than 1 time per week therapy and need to access it wherever they are. So obviously, I think you all know that in Montana, we have, quite a bit of a provider shortage. This is just a little snapshot of the Pacific Northwest in general. And when you zoom into Montana here, we're all dark navy blue, which means that our whole county, or every single county, is in a behavioral health shortage, which basically isn't a surprise to anyone, I don't think. I mean, there's a lot of need in our state and not a lot of providers. And the providers we do have, which are wonderful, end up having a lot of wait lists. So then when we get people with higher acuity needs, a lot of times they're ending up going out of state, which can be great for some people, but also really disruptive and really hard for students to have to like uproot their life and move to Utah to get the treatment they deserve, right? So Charlie Health, like I was starting to hint at, we sit right in the middle of the behavioral healthcare continuum. So I like this little chart here. I think it's pretty useful to see that, when patients are in active crisis, that means, suicidal ideation with a plan and intent, active self-harming or a crisis, usually they're put into the emergency room, psychiatric hospital if they're lucky, or a residential treatment center if they can find a spot, right? So that's like the highest level of care in terms of mental health for teens, across America, really. And then at the lower end of the care spectrum, we have just outpatient therapy. And that's when you think of like going to your counselor once a week or twice a month to get support. But, there's this huge empty space in the middle in Montana where there really wasn't another option for people transitioning between these levels of care. So that's where Charlie Health comes to fit in and see people either discharging from those higher levels of care or, helping people get this additional support they need before the emergency, before the ER stay, before the residential treatment center. So that's where we sit kind of in the behavioral healthcare continuum. I'm going to kind of skip around a little because I think this is super helpful to kind of get a look into who is appropriate for Charlie Health and who are the types of people we see. So we serve ages 11 to 30, teens and young adults. And I love this little snapshot of just a way to see who walks through our virtual door. So let's see, Jack, 13 years old, social anxiety, behavioral outbursts at school, and increased self-harming behavior. This would be an example of someone coming into our program. Or Jules, 16 years old, trans femme, LGBTQ in a small town, hospitalized after a suicide attempt and persistent depression and anxiety, also a musician. So that's kind of the type of person we're seeing walk through our virtual doors, are people who, are seeing quite a bit of need, and lots of times they're left looking for resources. So backing up a little bit to look at who is on the Charlie Health team. We have licensed clinicians, case managers, peer advisors, all on the team because we see, you know, quite a high acuity of clients. So we want to make sure that there's a big team surrounding every single one of our students and patients that we have. We do a wide range of evidence-based practices in our program. Everything we do is trauma informed because, you know, we want to treat our clients in a way of, you know, not what's wrong with you, but what happened to you and how can we move through that. So another thing I would like to talk about is how we create curated groups and connect patients with similar needs. So the bulk of our program are these peer supported groups, and every single night we have over 50 adolescent intensive outpatient therapy groups running and around 30 adult intensive outpatient therapy groups running. So that's a lot of groups, and all these groups have a lot of different specialties. So upon intake, we're looking at a wide range of, you know, factors. What is their treatment history? Do they have treatment resistant depression? Are they LGBTQ plus? Chronic suicidal ideation? What's their family situation? Things like that. And we, you know, get to put it all into this algorithm that I did not come up with. But basically a tech piece that helps match them into a group of other clients who are the same age, maturity level, and same life experiences, and then are matched with a therapist who specializes in those needs and is able to provide specialized care to treat those exact issues. So on the other side here, you can see just a few illustrative Charlie Health curated groups. So anything from, you know, 14, 15-year-olds with substance use using motivational interviewing as their, you know, primary therapeutic intervention, or 12 to 13-year-olds with suicidal ideation. We're using dialectical behavior therapy to support that. So really, I mean, the sky's the limit in terms of how we can create these curated groups. And because we're virtual, we can be really flexible. So if, you know, we have a couple people who all have the same situation going on and they all land in Charlie Health at the same time, we can make a curated group right then and there to address those needs. A couple months ago, we had several young adults all come into our program at the same time, and they all happened to have chronic illnesses. So we made a chronic illness group right then and there. It's pretty cool. And they've all since kind of graduated out of the program, which is pretty awesome to see. I will just breeze through some of our clinical outcomes. I think this is important just to go over because, you know, we're nothing without our outcomes. And, you know, our mission is to help reduce suicidality, the self-harm, and the mental health crisis in our youth. So we, the University of Pennsylvania has been studying our outcomes, and we have 2 papers in peer review right now, which is super exciting, but they have shared with us some of this preliminary data. And so we've been looking at behavior, hospitalization, thoughts, feelings, and experiences. And they have measured this, you know, pre-admission Charlie Health all the way through treatment, and then a year post-discharge. So some of the things we have found, you know, this is just kind of looking at who we see and the type of need we have. I mean, seeing that 55% of our patients have attempted suicide at least once in our life is a pretty stark showing of just how high the need is in our state. Similarly, 61% of our patients have admitted to inpatient or residential treatment in their lifetime. And this is just showing that, you know, a lot of people are seeking help and trying to get into these higher levels of care, but for whatever reason, you know, they're still needing that additional support. And we also know that 16% of these 61% of people have been to 3 or more residential stays in their lifetime, which is a lot, right? So this is indicative that a change is needed in how they access care and how they continue to heal. So we are, you know, looking at patient satisfaction as well as caregiver and parent satisfaction with our program. And we're seeing some really exciting things with that. 90% of our patients would recommend Charlie Health to a friend or family. And obviously we work with teens, and I'm sure you all know that if you get a teenager to recommend anything, it's pretty good. So we're excited that our teens who, you know, typically hate therapy are enjoying the Charlie Health groups, and so are our parents and caregivers as well.
Lauren, I'm so sorry, but we need to ask you to wrap up so we can move on to all of our other wonderful speakers. Would you be willing to send the slides over so we can send them out to the
Sure.
attendees?
Absolutely. I would love to do that. I was trying to go fast, but I know I talk a lot.
You have such amazing information. So yeah, if you're up for sending this, put your info in the chat.
Sure.
And folks can ask you questions in the chat. I think that'd be great. Thank you.
Yeah, sounds good. I will do that. And please, I'll put my contact info in the chat. So just reach out to me directly and we're happy to continue this conversation.
Thanks so much. Sorry about that.
All good. I will, can I give you back host powers? Is that the way to do it, Julie?
I think you're good. I think Jess
Okay,
can just
good.
dive in and share the video.
Fantastic. Well, thank you. Thank you. I'll put my name in the chat. Have a good rest of your day.
Thank you. And if you want to stick around, we'll have some questions at the end.
Sounds good.
Awesome. Thank you. All right. I am going to go ahead and share this guy with sound. This one. All right. Can everyone see the video?
Yep, we can see it.
This course is brought to you by the Rebecca Moores Foundation. We would like to thank the Rebecca Moores Foundation for their generosity in making this course possible.
This course was developed from the book, The Teacher's Guide for Supporting Students from Military Families, which was developed by the USC Building Capacity and Military Connected Schools team. In part, with grant funds from the U.S. Department of Defense Education, we would like to thank all those who helped develop this content, which includes Ron Avi Astor, Linda Jacobson, Rami Ben-Benishti, Hazel R. Atiol, Tamika, Monica Cristina Escueda, and Joey Nunez Estrada Jr.
Military children are an important part of a culture similar to many other cultures that will enrich your classrooms. This culture that makes up less than 1% of the American population. Along with the great sacrifices made by their parents to serve their nation and the pride military families feel in this sacrifice, military children can face unique challenges in school. They move more often than other kids and as a result are faced with the sometimes daunting proposition of living in multiple new locations. Deployments may also require their parents to be away from them for months at a time, and sometimes result in situations that introduce trauma to the family. However, despite these challenges, military students also bring with them potential areas of resilience and strength that can make them valuable resources for the classroom, as well as for other children. Their exposure to different cultures and countries, and their experience in adapting to or overcoming significant challenges that others may have never experienced, can be leveraged to support others. Being aware of these unique experiences helps those involved in the education of military children understand that these students might need specific assistance or resources, but can also be sources of strength in the classroom and school. This course will familiarize you with the unique strengths of and challenges faced by military children, as well as ways to help them learn and grow during their K-6 school years. By the end of this course, you will know how to recognize at least 2 unique challenges that military children face, and recognize at least 2 ways to leverage the strengths that military children bring to the classroom. Before we discuss the primary challenges faced by military children, a few important things to consider. First of all, it's very possible that those who work with children in a school setting might not even realize they have military students in their school, especially if those children do not show obvious problems or require assistance. Make sure to ask if you have any military children in your classrooms or school. It's an important first step. Second, the simple expression of gratitude for the parents of your military students and the sacrifices they are making by serving their country can go a long way to the development of open communication with these families. It can also make the students feel comfortable in knowing you appreciate their families and what they have gone through in this lifestyle. Keeping those 2 things in mind throughout your work will be the first step to being culturally aware of this very special group of children you might have the opportunity to work with. Knowing that, let's start by giving a brief overview of the 3 primary challenges faced by military children in the classroom. For specific ideas regarding how you can help in your roles as either teachers or pupil personnel, click the links under Resources on the course page. The first issue experienced by your military students is mobility. Military service members and their families are known for their frequent moves, which is part of the military lifestyle, as service members are relocated to a new duty station. You will hear military families refer to these moves as PCS, which means permanent change of station. Frequent moves can negatively impact a child's education and social life. Since it feels like they are perpetually relocating, military students are required to make new friends and try to maintain old friendships more often than their non-military peers. This can be even more difficult when they move after the school year has already begun. Moving in the middle of a school year can mean the military kids miss the opportunity to participate in extracurricular activities, such as team tryouts or other special interest clubs. Another challenge faced by military kids who move frequently is that educational curriculums vary according to school district. This can sometimes interfere with students' educational track, class selection, and even graduation schedule, as the previous school's curriculum may have them ahead or behind their peers. Despite the great challenge of moving frequently and the difficulties that accompany that part of the military lifestyle, children of service members often develop unique and positive traits as a result of relocating so often. They become very adaptive and resilient in their social interactions, quickly learning the skills of making new friends and adjusting to new groups of people. They often appear socially more mature and comfortable in unfamiliar settings than their peers. Skilled education professionals should watch for these skills and highlight them when they see them in action. Other students might learn from them. The second issue military students face is deployments. This refers to the time period when a military parent is away from home for an extended period of time for training or an actual mission. During this time, one parent is left in charge to carry the load and assumes the responsibility of both parents. In the case of dual active duty families, grandparents or other guardians care for the children if both parents are deployed at the same time. For some military kids, parental deployment increases anxiety and stress. Increased stress in children can lead to disengagement from schoolwork and a resulting drop in grades, as students may be focused on the absent and well-being of their parents on deployment. Also, because of the absence of their loved ones, students may be more vulnerable to feelings of isolation. Military students may feel that their non-military peers cannot relate to their situations, adding to their sense of isolation. The resulting emotional strain can lead to behavioral changes, such as becoming disruptive in the classroom. Of course, many children with deployed parents develop no problems at all. In fact, children who experience the deployment of a parent acquire interesting viewpoints on the world that might be helpful to their non-military peers. They not only learn about other parts of the world in which their parents are deployed, which could certainly be leveraged by education professionals in an attempt to teach culture, geography, or history with a unique perspective.
Sometimes my cursor disappears and then I have no control whatsoever. Sorry, we have to end early just because we have other speakers. So this is just kind of a sampling of some of the training that we're offering through those 3 modules I mentioned earlier, just to give you a little bit more information on how to support our military youth. So next we have Alex Holter. Alex, I know you have a slideshow, so I'm going to make, nope, you're already co-host. I don't need to.
Absolutely. All right. Can everybody see the screen? Yep. Cool.
Yep, but we're seeing your like slide setup and not just the one big slide. I mean,
Well,
it's fine.
I'll just leave it at this.
Okay.
All right. So my name is Alex. I am a licensed clinical professional counselor. I work with Many Rivers Whole Health, which used to be called the Center for Mental Health. I am the outpatient team lead over there, and I am a member of the LGBTQ community. I actually work as an out transgender therapist. I have my master's of science in clinical psychology and lots of emphases in sex therapy research and clinical counseling. So today I'm going to talk a little bit about how we can support LGBT youth in our school settings. So first thing I want to do is give you some just fast facts. So these facts have been pulled from the Trevor Project, and they did a survey that actually this last year. And so these are the most recent up-to-date facts. So 73% of LGBTQ students, or youth rather, reported experiencing symptoms of anxiety. 58 reported experiences of depression. 36% of youth reported being physically threatened or harmed due to their identity. LGBT youth are more than 4 times as likely as others in their same age group to attempt suicide. There's an estimated number, about 1.8 million youth who seriously consider suicide, with at least one attempt every 45 seconds. 43% of LGBT youth seriously considered suicide in the past year, and more than half of that is trans youth and non-binary youth. LGBT youth who had safe and affirming school systems reported lower rates of attempting suicide than their peers. And 60% of LGBT youth who wanted mental health care in the last year didn't get it. So these are just some facts from this last year from a survey from Trevor Project. And it's important to kind of take in and notice these things, because that shows how much we can be impactful, whether we're in the community setting, our school setting, or even as a therapist. Now, it's also important, though, to know about our state. So for Montana, there is the law now that prevents transgender students from participating in sports consistent with their gender identity. I know that there are many things being fought right now for LGBT rights, and there are some positives. I always like to tell people, yes, there are things protected in Montana, such as same-sex marriage, such as same-sex couples being able to be foster parents and adopt. But there is no law protecting LGBT youth from conversion therapy. That's still absolutely legal in our state. There is no law protecting students from discrimination in the schools if they are LGBTQ. And there are no protections in place for youth who identify as part of the gender spectrum when in the welfare system, but there are for those who identify as a sexual minority. So if they identify as lesbian, gay, or bisexual, they are protected. But if they are in one of the gender spectrum, whether it's trans, non-binary, genderqueer, any of those, they're not protected. They do not have a protection status right now in the state of Montana. So our youth, especially here, experience some unique differences and concerns than those even in other states. So what does this mean for you as school counselors? Well, this means that it's important for you to be aware of these things and to be aware of your students and maybe things that they are going through that maybe we don't know much about. Whether it's because you're not a part of the community or it's just because it's new information and we just need to learn more about it. So there are so many ways that school counselors can create a big culture change and support and create that support in the schools. Frontline staff, such as teachers and like school counselors, right? You're the ones that see them the most. You're the ones that get to see our students all the time throughout the school year. So the biggest thing to remember is safety. You do not have to tell the parents that their child identifies as part of the LGBTQ+ community. If the student says that they are not out to their parents and they do not want them to know, you do not have to tell them. If the student wants help and support with that, of course, it is best to just identify what are the safety factors and the risk factors for doing so. And same thing with being safe about talking to your, your rest of your employees and talking to staff. What is safe for that student? Like what would make it okay for them and safe for them? Because there might be people that would not be safe knowing that in the school. Creating signs or other passive ways of showing support and to show that you are a safe person to talk to. Having something as simple as a little rainbow flag sticker can make a world of difference for that student who is struggling with their identity and doesn't know who to talk to. And even having something as simple as putting your pronouns on your name tag, or having a sign or something with different pronouns about it, explaining what they mean. Something simple doesn't, you don't have to be in their face and in your other people's face about it. It might seem a little less concerning. Be willing to learn with them. It's okay to say, I don't know. And you can say, I don't know, but I want to learn with you, and let's figure this out and let's search together. That can be wonderful for students. That can allow them to also realize that adults don't know everything, and we can learn more together. Know your local and national resources, like who can you refer to? Do you know anybody in the community? Do you have people that you can reach out to? Do you know like national resources that you can direct parents, direct students, even teachers to? Understanding and knowing those and having a good list could be wonderful and helpful, not just in the moment, but in general. It gives you time and more space to learn about things. So I just have some basic websites to get started. There are some local ones as well as some national ones. So there is Empower Montana. It's a Montana specific website that has resources that is always wonderful. I always encourage everyone to look at genderspectrum.org. It is amazing. It has information for teachers, for students, for parents, for all this wide range of people. And it breaks down and really explains what is gender, how is gender identity taught, like what it means, and really just makes it tangible for people. And then there's also, you know, other ones as well, like the Gender Expansion Project, things like Gleason. You know, they have in-classroom kits specifically for schools on working how to identify and talk about these things. The Trevor Project, right? That's a big one. It's a big name that everybody tends to know. And Trevor Project also has Lifeline for LGBT students. There are other ones specific for trans, students, but the Trevor Project is always a good one to look at. And there are hundreds of other resources online. It's important to make sure that you find the ones that are going to be comfortable for you and help you learn, as well as for your students and their parents. I always like to let people know too in this that there are local resources as well that you can reach out to, whether it is places like Chaudère, Intermountain. There are therapists, there are people in the community who can be a good support, like Charlie Health as well. I've heard has wonderful LGBTQ supports. And even here at Many Rivers, reaching out and just having that extra person to talk to can make a world of difference. And sometimes just having that connection with an adult who is in the LGBT community can make that difference even more. Now, I made this very super quick. There's so much more information that I can give on LGBT specifics. I do offer coming into schools and doing more specific trainings if that is something that your school would be interested in. So feel free to reach out to me. That is my email address. I am always open to answering questions, even if it's, at random 2 a.m, I will try to answer as soon as I can. So thank you, everybody.
That's definitely dedication, Alex. Thank you so much for speaking. Any questions before we move forward? Otherwise, we will have the Q&A at the end. All right. Well, that being the case, it is now Katie Gluckert's time. Katie, do you need to be able to share screen?
Yes, please.
Okay, I will give you permission. There you go.
Thank you. Okay, and are you seeing that okay?
Yep.
Wonderful. Well, thank you for having me. My name is Katie Gluckert, and I am the South Central Montana AHAC Director. And this is a HRSA federally funded grant, and my host organization is with the Montana Hospital Association. Awesome. So the mission of AHEC is to connect students to healthcare careers, professionals to communities, and communities to better health. And in Montana, we have 5 regional centers in Montana, and our program office is at MSU in Bozeman. Like I mentioned, I'm with the Montana Hospital Association here in Helena, and we also have the North Central Montana AHEC is with the Montana Hospital Association. Give you a little background about our program and our mission. Let's get through that. So I wanted to highlight some of our programs that may be applicable for school counselors. So we do a whole lot of work in pipeline programs for healthcare careers. This includes our MedStart program, which is a 5-day summer program where the students actually get to go to a college campus, stay on campus, and learn about different healthcare careers. And then we have our REACH program, which is a 1-day exploration camp, and usually those are held at healthcare facilities. And then kind of specific to this topic, we also host Heads Up camps, which are similar to our REACH camps. They're 1-day camps, but they're specific to behavioral health. So providing students the opportunity to learn about behavioral health careers, talk to those professionals and kind of get a better feel for what that career fair might look like and different opportunities they could have to participate in that field of work as well. And then we look at different, we have a pathways brochure that I'd be happy to send to the group too, and it outlines the different programs at colleges and what kind of degrees can be earned from each college in the healthcare career. And then we also support HOSA and college fairs, school presentations, things along those lines. And then a little bit separate here, post-secondary programs, we also have our AHEC Scholars Program, which is a national program developed by HRSA and our state AHECs. Those are college students that sign up for additional education. One of those core topic areas actually being behavioral health. So making sure that these students that are going into healthcare careers are well versed in behavioral health and have exposure to it during their education. And in the same regard, kind of career fairs, really helping connect those students who may be interested in those careers to potential employers, as well as networking events. And then within our program office, which is the centralized office out of Bozeman, we do offer behavioral health workforce education and training. So they have a calendar and a training list that they host statewide, where we list any trainings that are being offered. And you can sign up right on the website for that. And that's applicable for healthcare providers, school professionals, anyone who's interested in behavioral health education and training. And we make a special effort for if there's any of those trainings that maybe are available local in your area for free, to direct those to the appropriate person. Like I know Jess has a lot of trainings in the Lewis and Clark area that are free through her grant right now. So just helping connect individuals to the training they're looking for in behavioral health. And then I did also, I'll stop this real quick. So stop sharing my screen. I'm gonna pull up one other document real quick. It is always when you're on the spot, things don't pull up like you meant to. There we go. Okay. And as I mentioned, I am an employee of the Montana Hospital Association, and behavioral health has been identified as a very important topic for the Montana Hospital Association. And one project we're working on is doing a repilot project of teen mental health first aid in Montana schools. So we actually have funding. It's a subgrant through Montana Department of Public Health and Human Services through the Mental Health Block Grant to coordinate and assist implementing teen mental health first aid in 8 to 10 schools in Montana in this upcoming school year. So we have funding available to help school staff become certified to teach teen mental health first aid, and then also to support school staff in becoming certified a one-day training in youth mental health first aid. So a little background on teen mental health first aid is a training program for teens, and it was brought to the United States from the National Council for Mental Well-Being in partnership with the Born This Way Foundation. And it teaches teens in grades 8 through 10 or ages 15 through 18 how to identify, understand, and respond to signs of mental health and substance use challenges in their friends and peers. So this is the curriculum that we are helping school staff to become certified to teach to their teenagers in their schools. So if you or anyone in your school may be interested in looking into this more, we still have 5 instructors spots available. And that can be for any school in Montana who's interested in implementing. So if this sounds like something that might be of interest to you, I'll put my information into the chat and feel free to reach out to me, and I'd be happy to talk to you a little bit more about what that might entail. And then also, if any of our general AHAC activities, the pipeline activities, those behavioral health specific or those general healthcare are interesting to you, please reach out and we can look at how we might be able to coordinate and collaborate with your schools. So I appreciate the time to chat with you guys for a couple minutes, and I'll turn it back over to you.
Thank you, Katie. I was really hoping that you were going to talk about teen mental health first aid. So awesome. Any quick questions before we have one more speaker to squeeze in? Okay, Bethany, do you need to share screen?
I do not need to share the screen. Thank you.
Thank you for joining us, Bethany.
Yeah, no worries. So my name's Bethany Coe, and I was a teacher the past 4 years, but have changed my career path to public health. So now I work for Southwest Montana Prevention. I'm a drug and alcohol prevention specialist, but my grant also just got mental health added to it. So one thing I'm talking about with a lot of teachers is the social and emotional well-being of our students, especially post-COVID. We've seen a lot of interesting behaviors. So one thing that I know the Helena School District is trying to do is they have WIN groups going right now, and the WIN groups help with reading and math. But the special education teachers are thinking about making a social and emotional WIN group about once a week. I know the counselors are thinking about different lunches they can meet together, and just a variety of ways the school wants to add extra time to fit that mark. However, a lot of teachers are needing to buy their own curriculum or work on their own supplies. And that's where I'm hoping my grant can come in. And I've started conversations with a couple people, but I thought this would be a good platform to present as well. We have several evidence-based programs that are effective. And there's one that I especially like that is called Positive Action. The reason I like it is because it is pretty grab and go ready for the teachers. But then also parents also often ask, how can we further help my student at home? And it has a parent curriculum as well that you can just send out to them. So that's one area that I'm striving for this year and hoping to give more information about to the schools. If that program doesn't work for the schools, there's several that we can look through. I'm also working with kindergarten bags to kind of help lessen the burden on teachers so they can provide these materials for their kindergartners. And then I'm also just being trained because I have not been in this job for too long. So I'm getting a lot of training and meeting a lot of people. Our community is doing so much, and I'm excited to hear all about it.
If anyone wanted to contact you, do you want to throw your information in the chat?
I will throw that in the chat.
Alrighty. Well, that is our list of speakers. Thank you everyone for sharing about your various programs. At this point, we can go ahead and do a Q&A.